Lisa, how did you become interested in physical therapy?
I actually had a personal knee injury from skiing years ago, and I had a surgery as a result of that and went through rehabilitation, extensive physical therapy to recover, and through relationships with the therapist, it became of interest to me, and so I pursued it.
What type of training does a physical therapist usually have to undergo for the profession?
It's a 7-year training program where you get your undergraduate in something related in health sciences, and then you go on for your doctorate. And during that time, there's extensive clinicals.
Talk about the types of conditions and injuries you've dealt with.
I used to work orthopedics, where I spent extensive periods of time working with post-op surgeries. I've since, again, found myself in geriatrics, where we do extensive post-neurological situations, strokes, CVAs. Again, we deal with a lot of surgeries here.
How do you alter your therapies based on the population you serve?
So when we bring a patient in, we start by evaluating them to determine what their limitations are, and then we decipher what their need basis is. We establish their goals, and that's how essentially we come up with their plan of care, which determines what we will do for them. And it's very individualized and specific based on what their needs are and what their clinical case is.
What role does technology play in your profession?
It is all evidence specific, so we really try to stay up and running in terms of a scientific approach to what we do.
What are the most difficult boundaries you face based on the population you serve?
Most healthcare professionals would probably agree it's the regulations based on insurance.
What was a specific, most rewarding situation you experienced while you've been in the field?
Oh, there's countless.
All right.
It's relational.
What is a sufficient level of training for this field?
What do I think? I mean, I think to a certain degree, the majority of your field work is where you're going to be learning. So getting those hands-on experiences is really indicated and really necessary.
Healthcare modes are consistently changing. People are pushing for home health care. There's higher co-pays. There's higher expectations on staff. You mentioned insurance. Where do you see physical therapy going in the future based on those consistently changing healthcare models?
We need to open up our doors to alternative methods of treatment. We can't block ourselves into what worked previously. We need to continue to focus on the research and the evidence-based outcomes so that we have some real proof behind what we're doing so that we can continue to stay marketable in service.
You mentioned earlier you work with a lot of post-injury surgeries like knee injuries. How would you go about diagnosing such an injury and treating
When we
it?
evaluate somebody, we put them through a series of special tests where we look at the dysfunction, we look at the function, we look at the range of motion and the strength, and we assess the musculoskeletal systems and anything that might be a limitation from the baseline of what they should be.
And you've worked among various types of therapies. What are the other types of therapies, and can you explain how they all relate?
Physical therapy, it tends to be more the gross motor, more of the bigger muscle functions, again, diagnosing those large muscle group ailments, whereas the occupational therapy, I think a lot of people get confused as to what those differentiate the two disciplines, but the occupational therapists tend to be more function related. And then we have the speech therapist. So a speech therapist, you might tend to think that it's somebody who just focuses on the speaking, quality of the speaking. But a lot of patients come through and they might have a stroke and they're not able to do, to speak or articulate the way perhaps that they had previously. So they're going to focus on that, but they also might focus on the cognitive or behavioral side of the therapies.